Alex. I'll be your nurse today. Can you tell me your name and date of birth, please?
Mickey Snyder, 7797.
Very good. What are you here for today, Mickey?
Just annual checkup.
Okay, well, I'm going to go ahead and shut the door here, do some hand sanitizing, and we'll get started. Are you having any kind of symptoms that you would like to be addressed today?
Nope.
Nope. All right, very good. Are you comfortable? Is the room comfortable enough for you?
Yep.
Okay, so what we're going to do is I'll just kind of go through your whole body assessment. So we'll start with one section and we'll move to the next. I'll listen to your lungs. I'll listen to your stomach, kind of feel around, make sure there's nothing, no abnormal feelings anywhere. Are you having any pain today?
Nope, no pain.
Very good. Well, your skin color is appropriate. Facial expression has a good affect. Can you stand up for me?
Yep.
I'm just going to have you kind of walk to the chair over there and then back. Just kind of see how mobile you are. Okay, you can sit back down. Very good. Dress and posture, all appropriate. Your speech is appropriate. Do you have any difficulties with hearing?
Nope.
All right. The patient is also alert and oriented. Can you tell me what year it is?
2020.
Very good. What month?
October.
Okay. And what season is it?
Fall.
Fall. And who's our president?
Trump right now.
Okay. Very good. So she's alert and oriented ×4. At this point, I would do vital signs. So I'm just going to have you stay seated for a minute. We'll start with this part of the exam, and then we'll kind of move on a little bit, okay? All right, so I'm going to have you kind of sit forward, and I'm going to check out your back. So you might have to turn to the side here. Very good. So I'm just going to lift your shirt up here if you're okay with that, and I'm going to look at your back, and then I'm going to kind of feel down your spine and underneath your shoulder blades, okay?
Okay.
Okay. Okay, so spine feels good, nice and straight, no normal bumps. I'm going to kind of feel under your shoulder blades here, okay? Just kind of palpate, make sure everything feels normal. Very good. Any pain with that?
Nope, no pain.
Okay. Her shoulders appear symmetrical. Musculoskeletal development is appropriate for age. Okay, I'll go ahead and pull this down. I'll have you turn back around. So now we'll do your lung assessment. So I'm just going to kind of watch your respirations as we're doing this. Everything looks good there. Appropriate depth and rhythm and a regular pattern. I'm going to kind of feel around up here. I just want to see if you have anything called tactile fremitus or crepitus. So I'm going to have you move your arms out just a little bit, like out here. There you go. Just going to feel down, make sure there's nothing, no abnormal sounds or feelings. Okay. I'm going to have you kind of lift your arm out here so I can palpate your scapular and subscapular nodes. Make sure there's no swelling or pain. Any pain with that?
No pain.
Okay, let's try this one. Any pain?
Nope.
Okay, very good. I'm going to take a listen to your lungs. So I'll start on the front. We'll do 6 different areas, and then on the back we'll do the same, okay?
Okay.
Deep breaths. I'm going to have you move your arm there. Okay, and I'll have you move forward a little bit, and I'll do the same to your back. Okay, thank you. Your breath sounds are clear. You're on your air. As far as just kind of a physical inspection, the skin looks appropriate. She has normal pigmentation for her ethnicity. Musculoskeletal development is all appropriate for her age and size, and she's all symmetric throughout. Can you lift your arms out like this? Okay, yeah, symmetric. You're good. We've done the respirations. Your respirations were equal. They had appropriate depth and rhythm. Your posture's good. You're not appearing to have any kind of respiratory distress. Your respiratory effort is also appropriate. I've palpated your chest wall. I didn't feel any abnormal feelings or hear any abnormal sounds there. Were you having any tenderness when I was feeling around on any of these?
Nope.
Okay, very good. So now I'm going to kind of palpate around your heart here just to kind of feel everything. I'm going to locate your apical pulse. I'm going to do some more palpation just to make sure there's nothing, abnormal there under the skin. And then I'll listen to your heart sounds, okay?
Okay.
Okay. I'm going to palpate around her heart.
Okay.
I'm going to find the apical impulse. I'm going to move your arm here. Okay. I'm going to listen to your heart. You can breathe normally.
Okay.
Very good. Heart rhythm is regular. S1, S2. I don't hear any murmur. I'm just going to kind of feel around here for the same thing. Tell me if you have any pain or tenderness. Okay.
No pain.
Okay. Tactile fremitus is not present. So now what we're going to do is I'm just going to kind of have you lean the chair back a little bit, and I'm just going to assess to see if you have anything called jugular venous distension or pulsation. On this side. I'm just going to feel up here, okay? I'm going to feel your other side. Nope. No JVD present, no pulsations. Her chest appears symmetrical throughout. Okay, you can sit up if you want. So what we're gonna do next is I'm probably gonna have you come over here and lie flat, like supine on your back for me, okay? I'm gonna grab a blanket here. I'm just gonna put it over your legs. And I'm just gonna lift up your shirt here a little bit just to see how you're breathing and make sure everything is rising symmetrically, okay?
Okay.
Is that okay with you?
Yes.
And then I'm gonna do your abdominal inspection while we're down there, okay?
Okay.
All right. I'll pull this up here a little bit. Okay. So you just lay flat there, take some deep breaths. And we'll do another one. Very good. Chest rise and fall is symmetrical. Her abdomen is symmetrical as well on all four quads. Skin appears appropriate. It's all intact, normal for ethnicity. I'm gonna take a listen, okay? Just to see all of your, make sure you have abdominal sounds in all four quadrants. Okay. And I'm just gonna kind of palpate around for tenderness or any kind of mass. Tell me if you have any kind of pain with this, okay?
Okay.
Anything there?
No.
There?
No. No. No pain.
Okay, now I'm gonna do some moderate palpation, so it'll just be a little bit more pressure. And then after this round, I'll do one with more firm pressure just to ensure everything's still the same. No?
No pain.
Any pain with any of those?
No. No pain.
Okay, one more.
No pain.
No pain there?
Mm-mm.
Okay, very good. Let me see real fast. Okay, so I'm gonna pull your shirt back down. I'm just gonna listen to your heart here one more time and kind of palpate again to ensure that there's no pulsations or thrills, okay?
Okay.
No pulsations or thrills noted. I'm gonna look at your abdomen one more time. I'm just gonna see, kind of auscultate your aorta, your renal, and your iliac arteries. And then I'm going to find your liver and just percuss around the borders to ensure that there's nothing abnormal, okay?
Okay.
Okay, that's good. So I'll take a listen first to those arteries. Okay. No roots present there. Now I'm just gonna kind of feel around up here to palpate your liver border, okay?
Okay.
Okay, now you're just gonna kind of feel me pop my hand on my other fingers here. I'm just gonna kind of percuss a little bit, okay?
Okay.
Okay, and now I'm gonna feel down the middle of your stomach here, just to check for aortic pulsation. Okay. We're all done here. I'll have you sit back up here to the edge. So now this next part, I'm just basically gonna have you stand up here in a minute, and we'll just kind of do a few different things. Here in a minute, I'll have you do some walking, like heel to toe, and we'll do some range of motion, and kind of bending just to see how everything's working, and if you have any pain or any abnormal findings there. So I'll go ahead and have you stand up here. Thank you. So I'm gonna have you turn to the side here in front of me. And what I want you to do is I want you to bend down, okay? Because I'm just gonna monitor your spine here. Okay, any pain with that?
Nope.
Okay, you can stand back up. So what I want you to do now is walk heel to toe for me from here to that chair. And so heel to toe would be like this. It's all just kind of like a balance thing.
And back the
Yep.
same way?
Yep. Okay, very good. So the next thing that we're gonna do is I'm just gonna kind of check your range of motion.
Okay.
So I just kind of want you to lift your arm out here and do some circles for me. Okay, same with the other arm. Then we'll do some range of motion with your legs. So just kind of, okay. Very good. While you're still standing, we're gonna do this thing that's called the Romberg test. So what you're gonna do is you're gonna stand with your arms down to your sides, and you're gonna close your eyes, and then here in a minute, I'm gonna have you take your index finger and touch your nose with your eyes closed on both sides, okay?
Okay.
All right, so with your right hand, take your index finger and touch your nose. Okay, you can release that. You have to keep your eyes closed.
Okay, sorry.
No, you're fine. And let's do the other side now. Okay, and you just stand there for a second with your eyes closed. Do you feel dizzy or anything? All right, very good. You can open your eyes up. So we did the heel to toe walking, we've done the Romberg exam. So I'm gonna have you stand now with your eyes closed, stand on one foot and balance, just for a minute. Okay, and now we're gonna do the opposite foot. Okay, very good. So now I'm gonna have you can keep your eyes open for this one.
Okay.
But I'm gonna have you hop in place on one foot, and then we're gonna switch feet and do the other one.
Okay.
Okay. Okay. All right, thank you. Let's see here. You can have a seat if you would like. We're just gonna kind of go over, kind of monitor how you get along with your activities of daily living. We want to make sure you can appropriately do these things safely, and if you need assistance, we can try to develop ways to help you out with these. So a couple of little things that we're gonna do here. I'm gonna have you take your socks off. And then we'll put them back on. And then we brought the comb, so I'm probably just gonna have you comb through your hair here just to ensure that you have functional capability of doing that. Very good. Any trouble with that? Do you have any kind of pain in your hands or your arm or wrist when you're performing any of those activities?
Nope.
Do you have trouble with those usually?
Never.
You get along okay with that?
Yes.
Do you have any kind of problems when it comes to bathing, dressing, toileting, ambulation, or feeding?
Nope.
No, okay. What about whenever you are preparing meals in the kitchen? Do you have trouble doing any of that? Would any kind of assistive utensils be of use to you, or do you do okay?
I do fine.
All right, very good. Your communication skills are fine. Not worried about that. So we've kind of went over your basic ADLs and your instrumental ADLs. Do you have any kind of issues with nutritional deficiencies or malnutrition usually?
Nope.
No, your diet's pretty well balanced?
Yes.
Very good. I don't see any kind of memory changes or signs of dementia present. I don't see any depression symptoms present. But do you have any kind of issues with that? Do you struggle with feeling sad or down or hopeless at all?
Never.
Okay. Have you ever had any falls, or do you have a fear of falling?
No.
Okay. And then as far as a social assessment, you would be your primary caregiver at home, correct?
Correct.
Okay. And your abilities and resources are fine. I mean, do you feel like you have
Yes.
plenty of those things?
Yes.
Okay. Do you have health insurance?
Yes.
So you're able to, make your appointments. You don't feel like that's a hindrance?
Nope.
Okay, very good. And then do you have an advance directive or a medical power of attorney to make healthcare decisions?
No, ma'am.
Do you understand what those things are?
Yes.
Can you explain that to me a little bit?
If I were to get in a life-threatening situation, the person would make the choice for me.
Right, if you're unable to make that decision.
If I'm unable to.
Yeah. Okay, well, I just want to make sure that we're all on the same page. Those things are all very important things to know and to have on file, just in case we ever get to that point. So in summary, are my exams done? Did you have any follow-up questions or anything?
Nope.
Okay, so my assessment findings were all basically negative. So your lung sounds are clear, you're on room air, you're symmetric, your posture is appropriate, you have facial symmetry, your eyes are perla, they're equal and round reactive. Musculoskeletal wise, you have excellent range of motion, you have good balance, your Romberg test was negative. Abdominal wise, you have positive bowel sounds in all 4 quadrants. There was no pain on palpation with light, moderate, or more of a firm palpation. I didn't feel any brutes or thrills. Your heart rate is regular throughout. There's no tactile fremitus anywhere. No jugular venous distension. Do you have any questions that I can answer?
A good annual exam.
Good annual exam. All right, well, that's all I'm got for you today, but I appreciate it. And if you have any questions, feel free to let me know.